Okay, have a good weekend, Doc.
Thanks.
There you go. Dr. Peter Lombard, 820. We'll just keep it going in the KUAM News Zoom room as we are now going to be joined by the new communications director down at Adelup, Krystal Paco-San Agustin. Good morning, Krystal.
Good morning.
Good morning.
Welcome back, Chris.
Thank
you.
you.
So rested.
Yeah, I am. I feel good. I might go run some laps on the commercial break.
Oh, okay. Do some push-ups.
Burpees,
Burpees. That's
Right.
the one I was thinking of. Okay, burpees. Yeah, thanks for having me. I just really wanted to take a moment to inform the public of our COVID-19 vaccine virtual town hall. And it will be happening this Sunday. That's Sunday, January 10 at 5 p.m. So if you have a question you want to ask, you can log in on our Zoom. I have the flyer here. I think Jason can pull it up. You can watch it on the governor's Facebook channel. You can also watch it on TV on PBS Channel 12. We basically want to give the community an opportunity to ask their questions. So what happened with our vaccine rollout is everything happened so fast. As you know, we received the vaccines on a Tuesday morning. We were vaccinating on a Thursday morning. And we almost didn't have a time to do community outreach and an educational campaign. And so what we're really grateful for is that there's so much demand. There's a high demand for the vaccine, but still a lot of people have questions. Maybe they don't have a doctor that they can ask. So I want to talk about, who will be on our panel. Again, this is a great opportunity, not the only time though. This will be just the first of many virtual town halls. We saw a lot of success with, when we dealt with dengue, we did a lot of town halls and we saw a lot of success with that. And so we want to repeat what worked in our last emergency with COVID-19. Our panelists include Dr. Felix Cabrera. As you know, he's one of our, he's actually the author of the COVID area risk score, the CAR score that we rely on so heavily for our response. We have Dr. Annette David, a very respected doctor here in the community, uses a lot of data, puts it into great perspective. We have Dr. Louis Cruz from our Surgeon Cell, one of the groups that advised the governor. We have Dr. Thane Hancock from the CDC. He's most familiar to the community when we did our dengue outreach. And Annette Uggan, of course, from the Department of Public Health and Social Services, a longtime member of their immunization division, and of course, the person really driving our vaccinations for COVID-19. So this is a great opportunity. If you have a question, if you have a concern, maybe you don't know if you want to take it once your time comes up, this is a great opportunity to ask those questions. What we're really going to do is we're going to focus on 5 main sections. And these are the 5 main questions that people have. And at the end, people can also have the opportunity to ask any questions that weren't addressed. And so each of our panelists will be taking on one of these sections. So the first section is the vaccine safe? Is it effective? Why do I need a second dose? That will be covered by Dr. Annette David. Our second section will be, I'm concerned about side effects. What are they and should I worry? And so Dr. Thane Hancock from the CDC will handle that question. Can I still get COVID-19 after the vaccine? I think a lot of people really need better understanding on this beyond their Google searches. And so I think Dr. Cabrera will be handling this question. And 4, what if I had COVID-19? Do I need the vaccine? So a lot of people, the governor, lieutenant governor, both had COVID. Are they eligible to get the vaccine? And will the current antibodies that they have, will it protect them? And last but not least, we have how are the vaccines being disseminated? And that will be covered by Annette Uggan. And Chris, actually, but while I was in the waiting room, you mentioned that people were getting turned away at Inarajan. I do want to confirm that. We have reached 200. So our ticketing system is working. We want to make sure we manage expectations up front. So we've already reached 200 individuals in line at Inarajan at our Southern Region Community Health Center. So to the viewers at home, if you're listening, if you're listening on the radio, if you're heading down to Inarajan to get your vaccine, please note that they will be turning you away if you're not in line already. I just want to stress to the community that this age group that we're targeting right now, the 60 and over, the boomers, we're dealing with about 20,000 individuals. And so we'll have many opportunities to get the vaccine. This week is not your only week to get the vaccine. Like Dr. Wen said earlier on your show, we're working to get the clinics online as soon as possible because people feel more safe. They feel more comfortable getting it at their clinics. We're working to get more vaccination clinics also on site, like the ones you're seeing at Okudu and at Inarajan. So again, go ahead, Bree.
Yeah, I was going to ask, what time did people start showing up to get their tickets down at Inarajan?
I'm actually going to head there after this interview. I heard before 6 a.m.
Wow. So tomorrow, because there's another clinic tomorrow, they should probably get there before 6. Have you heard anything about Ukudu?
Okudu High School, it's probably going to mean I'm not there yet either. I
Okay.
was going to head up there after in Iran. I don't have eyes on the situation, but it'll definitely be managed better because of the ticketing system in place. We had a lot to learn from yesterday's experience. We also want to remind frontline healthcare workers, if you are in line at Okudu High School, please turn on your blinkers, and we have to prioritize the second dose individuals. We cannot stress that enough. And so right now, most of the people that are due for their second dose are the doctors, the nurses, the people that work at the clinics. GMH and GRMC are taking care of their own staff. And I also want to take this opportunity to thank GRMC for really stepping up yesterday. They were so gracious to open their doors. They saw the demand, the line for the vaccine yesterday, and they said, we'll take 50 at a time. We'll help decompress your line. So thank you so much to GRMC for that.
Krystal, what happens if people don't get that second dose by the time they're supposed to?
I haven't talked too much with the doctors about that. This is us just really trying to enforce the message. You have to get the second dose. It's not as effective. It's definitely not as effective, and we don't want to waste a vaccine on someone who only got the first dose, won't take the second dose. And so we also want to make sure that that first dose, your experience getting the first dose, is enjoyable or at least pleasant enough that you'll come back and get your second dose. Again, you need 2 doses for both Pfizer and for Moderna. So Pfizer is the 21 days, you come back for your second dose. The Moderna, I believe, is 28 days. We actually activated a call center to remind people to come back for that second dose, just like you would if you had an appointment with your doctor. Someone would call you and say, hey, don't forget, you have an appointment. This is what you need to know. And so we've activated that at my office, actually. So they're making those calls to get your second vaccine, please. We cannot stress that enough. The vaccine is only effective in 2 doses.
In Iran, it's only for the 1C category, right? And
yes.
And are they also are they getting Moderna or are they getting Pfizer?
I believe we may have transitioned to Moderna today, if not yesterday, because of the high count. So we should be in Moderna today. That is what I am tracking. You don't get a choice. You don't get a choice, that's for sure. But you have to make sure that both doses are the same. So if I get Moderna today, in 2 weeks or in the 21 days, I'll get Moderna, the second dose. And your shot card will communicate that. And so if you're coming back for your second dose, please bring your shot card. Just help properly track that you've received the vaccine.
Can you tell us any other information? Dr. Ho Win was on earlier, and he said that there's a strong possibility starting Monday or Tuesday that private clinics will begin administering the Moderna vaccine for the priority 1C.
That is the goal, to get the clinics online as soon as possible. I understand that public health, specifically Annette Uggan, is working with the clinics to make sure that they have the structures to support the storage. We're fortunate that right now if we're on Moderna, that Moderna is the less temperamental of the 2 vaccines. As you know, Pfizer needs the super cold freezer, Moderna, not so much. It's not as temperamental. So it's something we can more easily disseminate to our clinics. We're working to get that online as soon as possible. Monday would be ideal. It's the goal to get it online next week. Again, if you're not comfortable going in line, waiting with the crowd, we understand that people might want to go to their clinics instead, and that would also help decompress any crowds that we're experiencing with the public health clinics.
What about with the homebound Menemcos? When is HSP going to start heading out and vaccinating these homebound residents?
I understand that HSP will also, not just HSP, I think there are 2 other home providers. I was speaking with Xenia Piscina from Public Health yesterday. She says we'll roll out the homebound next week. I want to stress that if you need homebound vaccination, please call your village mayor. They are taking these names, the addresses, and we're going to head out as early as next week. Xenia told me that yesterday, so I believe that to be truth. If you're HSP, yes, we'll be cared for. If we want to make sure that we capture all those homebound residents, I know that the Joint Information Center, we are receiving a lot of inquiries from individuals who cannot go out to the sites. And so they would operate much like we did the war claims. We did homebound for war claims, also for voting, homebound voting. So it would operate similar to that.
And just had one more question regarding the change in the PCore. How soon should we anticipate that the governor will put us into another PCore? And
Another status.
Mm-hmm.
We can expect a shift in PCore if we continue to maintain a steady CAR score. You did see an increase in the CAR score in the last few days. We are at 1.2. I think Dr. Lombard before me did a great job at noting that a lot of the new positive cases are coming from quarantine, and they are travel related. So I thank him for highlighting that. PCore status, I would expect that we would shift PCore levels before or upon the opening of face-to-face instruction. I would see those two corresponding.
Mm-hmm. Would the PCore have to change in order for these schools to resume face-to-face?
I don't believe so, but it's the logical thing to do at this time.
Okay. And prior to the rollout of the private clinics being able to administer the vaccines, will you or the Joint Information Center be releasing a list of those private clinics?
Most definitely,
okay.
Yes. We want you to know which providers are allowing for the vaccination or doing the vaccinations. Again, we want more people to get vaccinated. I think the issue is not that people don't want to get vaccinated. It's people can't get vaccinated fast enough. I did talk to some people in line yesterday, and they could not wait. They didn't care if their time wasn't until noon. They showed up at 8 o'clock. And, we did ask for people to show up at their designated times. Of course, that's not going to happen. There's a lot of excitement. The lines did stretch, and that's a great testament to people wanting to be safe and take care of themselves and their families and not get, fall ill severely ill from COVID-19.
I don't know if this was covered, Bria, but there's a question in the comments. Can people in quarantine who meet the criteria for those who are getting vaccinated now, can they get the vaccine or?
I understand, yes. You just communicate that to the nurse that, I meet the criteria. So if you're 60 and over in quarantine, either the nurse or the Guam National Guard person that attends to your room can take note of that, and then we can communicate that and make sure that you get vaccinated as soon as possible.
Right. I think you're going to be put on like a priority list. Okay. I think Adriana covered that a couple days ago.
Okay. Well, congratulations.
Okay, Chris, welcome back.
Yeah, and congratulations on the promotion. I just wanted to ask, what do you make of these criticisms some people have about communication and transparency from the administration, and what are going to be your biggest challenges and goals in this new position in 2021?
I think our communications section at the governor's office has undergone a lot of changes, and I think that's understandable as we try to figure out what types of messaging people absorb, what we need to message better. I definitely recognize that we have a lot of shortcomings. We definitely need to put stronger messages out there. COVID-19 has really tested all the things I learned in my emergency management classes. I did get my master's and I did get my MPA with a focus on emergency management. Really just, my goals are just continue to build that trust in government. COVID-19 really tested all of us. Oh my goodness, I'm so sorry about my dogs. I think you can hear them. But just making sure that people get the information they need, making sure that we answer the questions, that we're not dodging questions, that we're as transparent as possible. Chris, Sabrina, you know me for a long time. Jason, you know me that I'm an open book. If you asked me, I would tell you. I'm very honest. I hope to be very. I hope to continue that trust that I built with my time at KUAM. I think that's really helped me transition to the public sector. And so that's, my main goal is continuing to build that trust. Now we work on recovery. That in itself is a monumental task, and trying to communicate all the initiatives that are out there to help the people. That will be, I think, the biggest hurdle moving forward.
Right on. You good?
Yeah.
Okay. Well, thanks,
Thanks,
Krystal.
everyone. I'll be heading.
Thanks, Chris.
Thank you so much.
Enjoy your drive
Bye.
down
Keep
south.
safe.
Okay. Yeah, have a good weekend. See you. Okay. 8:34. Quick break and.